Dr. Margaret Winters, Great River Chiropractic and Whole Body Health, and today I want to talk about the booty. Yep, the glute. It is the metabolic engine of the body. We got to have this work because it's the driver for walking. In the immortal words of one of my mentors, these glutes were meant for thrusting, and indeed that is exactly right. Of course that was a guy, you know that was a guy. It's still valid, right? That's the thrust forward for the walk. So you may already have a J-Lo butt, you may have a butt that's halfway down your knees, doesn't matter, you still need to work your butt. Booty's with us for as long as we're alive, and we can keep it as bodacious as we can. That's the idea. So let's talk a little bit about the squat. It used to be, we would say, and I was guilty of this, and if I ever said this to you, I apologize, I was wrong, that the idea was to, under no circumstances was the knee to go forward of the toe. Not really accurate. But the point of that statement was that the squat is really about the hip hinge. It's about getting that booty back behind you, right? So notice, I'm going to scoot down a little bit so you can maybe see my feet, maybe not. My feet are hip distance apart. I have a little bit of pelvic tuck. Nice inhale, boom, down I go, right? I'm trying to get pretty close to knee level. I can go all the way down if I need to. That's a little hard on my knees, so I don't usually go that far. I don't need to do that for working the glutes, which is maximus, medius, and minimus, which is just a fancy way of saying big, little, and in between. But idea is just hip hinge, get down as far as you can, come on up. And a little bit of squeeze, a little bit of pelvic engagement at the top, a little extra, doesn't hurt. I like to do sets of 10, build up to 100. The other squat that you can do is a plie squat. So you kind of get a little external rotation at the hip joint. Your feet are basically pointed 10 o'clock, 2 o'clock, more or less. And you want a good turnout here because your knee wants to point at your little toe. So a little bit of pelvic engagement. Get my pants out of the way. And down we go, and up, and down, and up. Again, sets of 10s, work your way up to 100 or beyond. And you can tell I already got a little bit of a cardio workout doing that. So give it a whirl, see how you like it.